Hey, you must be doing great. Well, thank you very much for joining on Sunday. Actually, today, we will be talking to Dr. Singh. That's one of the agenda. But other than that, I have opened this webinar to invite your friends and to people who are outside our organization so that they can understand how this future holds, what is there in future for them. Because, we all are young, we are looking for career growth, and what could be a better opportunity than somebody who is right there in a healthcare business in the United States and who is doing so well, who has hundreds of physicians working with him, and he is also instrumental into some of the IPAs and capitation and some of the innovations which happened in US healthcare business. So, today we are going to have a very, very exciting evening. I know it's a Sunday night for all of you guys, and you just logged in so that, I know. Thank you very much. I really appreciate, because Rajinder, Amit, Rahul, Siddharth, Shashikant, Pratik, Prakash, Raj Mohan, thank you very much again. Thank you very much for joining. So I can tell you one thing. When I came to this country, I learned from this man a lot, because he comes from Jaipur, and we have my father introduced me to his father, and that's how I came to know about him 20 years ago. When I came to this country, I heard his name and I wanted to meet him, and I have met him at several times and several places. So I just want to make sure that you all are ready to hear him. Are you all logged in? You need anything? If you have friends who are not able to log in or do not have computers, tell them to log into a smartphone. They can use a smartphone and they can log in. Are you able to hear us? Are you able to hear me well? Without any problem. So, and then I will invite him. I have already sent him the link, so we are waiting for him. But let's test. Are you able to hear me? Say yes or no. Now, in this group, anybody from outside ISIS organization, anybody who is outside organization, please raise your hand or say yes or no. Or any of our old employees are here, because this is open to all. So we would just Dr. Singh is joining the room. That would be fantastic. Dr. Singh is coming on board. Very good.
Hello.
Dr. Singh, welcome. We want to see your face. Can you turn on the camera, please?
Turn on the camera. Hold on. Serena, my daughter is helping me.
That's good. So camera is in the top left-hand side. There you go. Fantastic. You look handsome as usual.
I don't know about handsome, but presentable is all I.
Presentable. So are you still walking? Are you on your phone?
Yeah, I'm just going to, because I couldn't access it on my laptop. On our laptop, but that's fine.
Okay, so can we
Is it okay on the phone?
Yeah, we can see you. As long as you can speak, we can see you. I just want you to be stable at one place.
I'll be stable now.
Yeah.
It's difficult for me to be stable, but I'll be stable.
Well, all entrepreneurs don't stay stable, so that's very good.
How's that?
Perfect. That looks fantastic. So if you see in the right-hand side, we have a lot of young people joining. Most of them are from Jaipur. And I was telling them our story between you and me, that how we know each other through our father.
Yeah.
And Dr. Singh still comes to Jaipur, but he never got a chance to come to our company. And I have always pushed him to make at least one visit. But you have seen the area where we are in Mahindra City. So anytime you go to India next time, you have so many fantastic people who are available right now to interact with you, and they are very eager. Some of them really wanted to hear you out last time when we faced some technical challenges and we could not do this webinar. So they were asking, sir, we really wanted to hear him out. So I said, we'll find some more opportunities. I mean, I can always reach out to him and say, hey, Dr. Singh, I need you for 30 minutes.
Absolutely. So
That's the kind of relationship we share. So
yes, absolutely. This today was easy to set up for some reason. I don't know what happened last time.
right.
I think I was trying my computer, and that's why I couldn't do it. I'll have our people work on it. Some webcam issues, but
so now you're talking from your smartphone, huh?
Yeah, this is all smartphone.
Oh, fantastic! So look at this technology. This is great.
Yeah,
very good.
So I did visit your office from outside.
Oh, you did? Okay, good.
I went on a weekend. There was nobody there, but I didn't even know much about BPO at that time. This was about 5-6 years ago.
Right.
And my dad had asked to meet you, and then that's how we got together. And
right.
So a lot of great things are happening, as you know, between the two economies. We are seeing a lot of arbitrage of talent. And unique synergies happening. As you can see, tremendous synergies happening on both countries have their own strengths, and it's being kind of multiplied and augmented. Both countries are becoming stronger because of our one great relationship among people, now among governments, but also great relationships in our work,
correct,
in our businesses, and how we can augment. So you can make things move faster here. The economy can start humming like the old days if we can reach a higher level on our own. So what we should think of is going up the value chain.
That's true.
The higher we go on the value chain, we help ourselves and we also help our partners. And so I see the economy here, when Access Healthcare here, as a partner to the entities in India. And initially what happens is people get afraid. Oh my God, we're going to lose jobs. That never happens. You only give more jobs, and actually both come out together. It's not a zero-sum game.
Correct.
Zero-sum game is either you get it or I get it. In this case, when we create something together, we have a bigger pie to share.
Correct.
And that is what I have seen in my experience. And people who can understand this, then their job is how to learn better to provide a greater value to the partner. So which you are doing it, you've done it very well. And then talent improvement, what we call upskilling, is so important. And to learn the new things, the cutting edge in healthcare, whether it's healthcare or IT, or even what we used to call knowledge process outsourcing instead of BPO, KPO. So not just business process. Business process is you just do my stuff. That doesn't enhance, maybe a little bit,
right?
Maybe 10%, 15% return. But knowledge process outsourcing is now you are enhancing your knowledge to help me, and it makes multiple
adding value in your business. So, and that's exactly, yes.
And then I feel there's a third level where what we would like to do is a creative outsourcing, which means now what I'm doing is people are doing the brand designs. You know how smart our Indian designers,
yes, absolutely,
advertisers are. And unfortunately, I'm in an area, where we don't have too many graphic artists and designers. So they are doing the branding, and then they're helping us set up the marketing here. So feet on the ground here, and using that creativity, whether it's in software, whether it's in brand designing, whether it's in business presentations, and using that creativity to enhance the business here. And that has made it very exciting. I think we have some beautiful years ahead of us. As
That's
long
true.
as
you set up a perfect foundation of what we are going to talk today. And my motivation was to bring these people who are working for us like for many years, but they know exactly as you say, only one or two business processes.
Right.
And they think what they're doing is with their best of the capabilities, and what they are doing is best.
Right.
And, in India, somehow, we have a mindset that, even if we do it best, we just expect that every year we should have some kind of appraisals by default. And I call it, just because you are in the company for 10 years doesn't mean you are entitled for an appraisal, just because you are there. But if you are there and you are adding the value in my business, and that value is also multiplying value in my customer's business, then yes, you are entitled to get not only appraisals, but keep on getting growth financially as well as mentally, because your job is challenging. Your things, what you're doing, require you to enhance your own knowledge and skill set, and which will enable your partners or your customers value chain. So you would automatically grow in the value chain. So this is fantastic. So some of the, if we just talk about healthcare, we have seen it all started with transcription. We started as a transcription company.
Right.
They started outsourcing those. Then medical billing. In medical billing, people started doing mostly data entry work, then chart submissions, claim submission. Now a lot of coding is happening in India. And then we comes out to, AR collection, and all of that good stuff is happening. Where do you see this healthcare going and moving forward? Where do you see the career opportunities, which is right down the line, 6 months or a year for these youngsters?
So in healthcare, I think all of them should become CPCs or CRCs. They should, and good news is you have AAPC there, so proper licensing and certifications can be done. That's a preliminary. But what they should try to do,
which means that some kind of certification, just because they may not know the full thing, but explain this in detail, like what exactly you expect from them, and what is the reason they should do that? Because their immediate thought is, well, our work is happening, we are doing what we are doing, why do we need to upgrade ourselves? Because it costs them money.
Absolutely. So I'll tell you what I did. We created a team of CDIs in India.
Right.
Because here we were having a problem. Here we would train people, so get them certified, and then
they leave, or
they want
something else.
Just because we are in an area where we don't have
enough resources.
Obviously young people, they want to be in bigger cities. Right. They want to go to live in Tampa. They don't, just like everyone wants to live in Jaipur.
Right, that's true.
I understand it.
So what is CDI? What is that CDI means?
So clinical documentation improvement specialist.
Okay. Mm-hmm.
Right? So I write a note. I'm a physician. I'm writing a note. I'm so busy. I finish my note. I move on.
Right.
Then someone needs to take a look at the whole chart and say, this is what you missed in quality. This is what you missed in your HCC codes. This is how you could have improved your documentation, and gives me the information. So everybody told me this is impossible. Not going to happen.
Right.
It's too difficult. So I started training them in September last year. And we created what we call a Ghatak platoon. They call it Ghatak platoon. I guess there's a movie or something. Yeah.
Ghatak Dasta.
So Uri or something they did. So I said, okay, I will spend hours every week, 2, 3, 4 hours, and I'll teach you as long as you can learn it. By end of October, they were reviewing charts. Now every chart, in December, they completed all the charts. They review the charts now before the physician sees the patient. They'll tell them what are the gaps. I have the gaps when I'm seeing the patient. I already know. They've sent it to me.
Oh, so before even you see the patient for follow-up, they will review your previous chart.
They've reviewed everything.
Okay.
They are my personal assistants, my executive
your personal assistants.
I'm going in with
what knowledge do they apply? Certainly not a clinical knowledge.
Yeah, so since they have the knowledge of CPC, right? Coding.
So they have to be CPC coders. So they have some kind of CPC coding.
Absolutely.
Okay.
They have to know what. Suppose I write DM2 with DM peripheral angiopathy.
Right.
They need to know what that code is, right?
Right.
What it will imply. Suppose I write ulcer, and then below it I write diabetes, and then below it I write peripheral vascular disease. They have to be able to connect it and say, this ulcer is because of diabetes, it becomes a diabetic ulcer, or ulcer secondary to peripheral vascular disease. And guess what happens to your HCC? Your HCC goes up. So cirrhosis of the patient, and you have a patient with ascites. Suddenly now portal hypertension, your HCC goes up. So they started doing that. Now we are busy taking care of the patients, focused on the patients. We need a set of eyes watching from above my shoulder, looking at it and say, okay, doctor, you missed this here. You could have improved this here. You wrote an ulcer there, but you didn't describe it in your exam. Oh my God, I forgot. So either I take a picture or I document what the size of the ulcer was to make me, one, more compliant, more profitable, to give me opportunities. And all of them may not be right. They're just giving me possibilities. They're not writing my note.
Okay.
Then I look at it, I say, I agree with this, I don't agree with this, I agree with this. I tell you, they have been so impressive, these kids and I say kids because they're much younger than I am.
Yeah.
They have been so impressive, 20, 21, 22-year-old young men and women, and they have enhanced our practice and amazing results. We are seeing great results. We have spread our reach across.
But how do you build? Do you wait until they give their output to build those claims?
Right, so,
because if you wait, your days in account receivable will go high.
Right. So what happens is, so they gave me the codes. I finished my note. Now they'll go back and check if I did it. Now it's DM2 with peripheral angiopathy, and I forgot to type it in. So they'll correct me, doc, you forgot this, you missed this. So I said, oh my God, I'll go and fix it. Right. Within 24 hours, I fix my note. Then ideally they take my note and they bill it, and they track every HCC code, make sure it goes through. So they are not only my coders, they're not only my billers, they have become my instructors.
Business analyst. Your business analyst, basically.
That's right.
So they are giving you a business advice based upon your clinical note on day-to-day basis.
That's right. And then they've tracked quality also. So quality scores start going up, compliance scores start going up, health plans are happier, profitability goes up, and every physician in our group is very happy.
Because their revenues are increasing,
right.
And they are getting and they are more compliant, basically. They are more compliance. Yeah.
Accuracy is going up.
Yeah.
If there is a wrong code, they'll tell you this is wrong, doc. So you cancel it, delete it.
Right.
And they will help delete it. So, taking charge is important. Taking ownership, taking ownership.
Ownership of responsibilities. That's very good.
You take ownership and say, I'm going to take care of it. So suddenly now I'm not worried about that part of coding. I'm not worried, oh my God, I hired 5 people. I'll lose them next month because they all want to work from home. They're moving to Tampa. They're moving to Orlando, or New York, which of course, now after COVID, things have changed. But now everybody wants to move into our area. But young people, they want to be in big cities. And I understand it. So Jaipur has been a godsend. Noida has been a godsend. Bangalore, Hyderabad, and we
have somebody actually who worked for your coding from Hyderabad, and now he's working for us. Anand Dubey, I don't know if you know his name, but he's sending some messages in the right. He said, I know Dr. Singh, I've worked and I've learned under him.
Good, very good. I can't see your messages here, but
so the one who is on the top, Anand Dubey, he sent a message. So he told me that I have worked with Dr. Singh.
Good, very good. And they're doing very nice things in Hyderabad. The team that we have, I guess you're talking about Data Marshall.
Right.
They are doing some really exciting things. I'm very proud of them. They're a very good vendor, and they're doing some exciting things in your recoveries.
That's good.
So you may want to.
We have somebody at our team now who learned under you, so we can always upgrade our team and hire more people.
Yes. So as a company, Kunal, you have to constantly look of upgrading your going up the value scale. But that will only happen if you have team members who say we are going to create what is called a learning organization.
Correct.
So each person can learn something and share it with others. Not because you want to hide knowledge. The moment you hide knowledge, you lose it. The moment you share knowledge, you enhance it.
That's a very good thing. So every time a person, whether he is a colleague, supervisor, even if I tell them, just share what you have.
Right.
And that is, I think, the very good absolute analogy. Yes. So learning organization.
What we call a learning organization, which means each person says, I'm going to learn something and I'll teach others. So you become a teacher and then you become a student and you
Correct.
will learn something from the other person. So people learn, become masters, and then do presentations to each other and try to bring everyone up. Collective ability, what we call institutional memory, needs to go up. So everyone needs to start learning. The biggest problem, what did HP's CEO say? We don't know what we know.
That is true. That is true. We don't know what we know.
And that was the biggest problem with HP.
Yes.
You saw what a big problem Hewlett Packard had, one of the biggest, best companies in the world for the longest time, and they had a crisis. They were going to get shut down.
Right.
So the CEOs, they're brilliant people there,
That is
but
true.
they wouldn't share their knowledge, so nobody knew what they knew. So that's the concept of a learning organization and what is called a knowledge-based organization, where the focus is developing one ability, one learning every 3 months, every 6 months. Every person says, I'm going to learn, I'm going to become an expert in quality, because you know quality is changing, right?
That's true.
HEDIS is your whole star rating caps, HEDIS is going to get changed. So everyone needs to be on top of it. 2-3 people who love quality.
Tell them a little bit about HEDIS and how we can improve the score, because that's a lot of, I think that's one of your core areas, what you're doing, and IPAs.
Yes.
Tell us a little bit about that and how we can have these coders or billers help physicians improve their scores.
So there's a big push, in the old days we used to have fee for service, right? You saw the patient, you wrote something, and then it got billed for. Now it is more fee for value. What value have you brought to the patient? What are the outcome? Fee for outcome. So suddenly we have changed. We have reached a point where bundled payments have come in. So have we improved the life, the quality of the patient? And how do we measure it? And so accountable care organizations, you're seeing managed care, whether Medicare, Medicaid, quality has become big. And quality for everyone is being measured, and it's being put online. So HMOs, hospitals, doctors, nursing homes, and I guarantee you in a few years it'll be even by coders.
Yes.
Coders quality certification, when they get tested, when they get audited, how effective is your coding? Are you above 95%? That will all be online. It will be mandatory. So how do we improve the quality of the organization where we are working? And when I say quality, I mean the clinical indicators. So it's broken usually for health plans or for our practices into 3. One is HEDIS, the second is CAPS, and the third is HOS. And I think everyone should familiarize themselves with it.
Right.
So HEDIS these are measures that we do to take care of the patient. Someone has diabetes, we have to give them an ACE inhibitor. We have to give them statins. We have to get eye exam, urine test, cholesterol. We have to make sure we check their feet. Someone has turned 50, we get a colon screen, or a woman.
So when you do that, right, these people who are doing your back office, they make sure to remind you or send you alerts and notifications that whether these steps during this process was taken or not taken.
Yeah.
Or whether they were documented properly or not.
That's right.
Okay, so it's a constant reminder. It's a constant sending you the alert. Don't you think a technology is coming to take over and do all of these tasks in normal circumstance, like in next 6 months or a year?
Yeah, so we developed our own platform which got NCQA certification, and it has portals so people can patients can enter their information. So the patient says, I had my eye exam, he just enters it. Now it has reduced one step, right? You don't have to call the patient, did you get your eye exam? It's already in. Now, where was it done? That doctor's report needs to be there. If it's not there, you know where to get it from. So making sure that these reports are all in, it becomes the responsibility. So for what we are trying to do is each CDI is responsible for, say, 1,000 patients. Make sure all quality indicators are addressed, all HCC codes are addressed, billing is done right, coding is done right, everything is 95% or more compliant. So the other part,
once you do the billing, once the claim is sent. So what if 5% cases it is not done correctly? You rebill them?
Yes. They have to track
So,
it. They own it.
okay. They track it, and then again there would be like increase. Then that there would be
Tremendous.
increase in the refunds.
So that's what we found. We just found a 5% increase last year when we started reviewing these. Found a 5% increase. Can you imagine this? This is found money. You've done all your work.
Which I understand, but then your refunds, and then because of this process, your other refund process for Medicare would also increase.
Yes. Yes.
So here you're making money, getting more revenue, which I understand, but the whole process. So do you think that is still viable and profitable, even
Absolutely.
all of these efforts?
Absolutely. Why? Because now the technology is there to do more advanced analytics. So when you said what all can they learn, one was, I think I said CPC or CRC, all these.
Some kind of certification is good.
Getting
And the
into
second is the
analytics.
technology.
Those who know coding or software, or they must learn how to code, whoever wants to, whoever has the aptitude, and get into analytics. Because eventually, I know you don't like AI much, but AI is going to start
Replace the
affecting us.
human intelligence.
So natural language processing is already here. You have robotic process automation, and all that is going to happen. It's going to happen. Your job is going to become so much easier once you put RPA.
So then they need to use technology. They need to understand the technology. That's the second. First is get some kind of certification and knowledge and wisdom in that particular subject, and then also it's not going to be data operating or data entry operators anymore. They are more than that. They would be more like business analysts, and they can grow multifold because sky is the limit. When they learn all of this, they would use this technology to aid their own knowledge, and then they would, send the claims back, and they can really analyze how much, like you said, if you were able to increase 5% revenue for some company, they are adding a value for your business.
So domain expertise. They have to have domain expertise. If you develop domain expertise, you will have great value, and you have a great advantage of being in a cutting edge area, part of a company that has connections with new businesses. Healthcare is growing rapidly in India and the US.
Both. So, So people have very high hopes.
Yes, it will grow. It has
the way I think they have just introduced healthcare in India. I think it was going to be the same system what we have here. So in next 10 years, the same people would found more opportunities in India than probably in US the way it is going.
You will, because the economy is going to bounce back. The measures that are being taken in the last month, 2 months, whether we agree with, I'm not going to talk about politics, but the measures that are being taken are amazing.
They are amazing.
If anybody's paying attention, massive changes are happening without even us realizing what is happening in the Indian economy.
Correct.
And if you really look at it, and that'll be another discussion someday if we want to discuss politics, but quietly, a revolution as we saw in 1991 is happening right now. We don't see the effects, but I guarantee you within 6 months, we will see, a year, 2 years, you will see these effects. And a massive push is being, what we call Atmanirbhar, and I won't go into the politics of it, but it's a tremendous insight, inspiration, and COVID actually is a great opportunity.
Great blessing. I take it as a blessing the way it has put the entire world into an order. So world is more orderly. India, we have more order. I mean, for the first month we got a little bit shaken, but I think it's a blessing in disguise for all of us.
It's a shot in the arm. Whatever is happening, two things are happening that have really pushed us in India to be more suddenly wake up and say, okay, we need to get out of our tamas. And we need to start getting better at what we do. So we needed a little kick. And I think we just got that. Two kicks have happened.
Yes.
And so I won't talk about the second kick, but everyone knows about it. Yes. And so at the borders, we have been beaten up.
Yes.
Our people have suffered and sacrificed themselves, but suddenly it has woken up everyone, and we are suddenly doing things for ourselves, no longer dependent on others, and that's a beautiful thing.
So beautiful signal. More empowered nation, more stronger nation. Absolutely. And I think what we are doing right now is we are basically showing them a path forward into their own careers, where they can aspire to be in next 6 months or a year. It's not going to be the status quo, what they have been doing for last 5 years, 6 years, 10 years. If they don't change, they will vanish. If they don't change, they will vanish.
Yeah.
So do you think all of this billing, coding, and the opportunities we were talking about in IPAs are going to redefine their careers?
Yes, absolutely. I'm telling you, we are redefining ourselves in the last 8 months, 10 months. We have redefined our whole company and obsessive focus on every code going out, every documentation. And Kunal, 5% improvement is nowhere. We are seeing 10% improvement. But to be conservative, I don't want to give false expectations. 5% improvement. Think about it. All the work you do, everything is done. At the end of the year, someone says, all the work you do, I'm just giving you extra 5%. Everybody gets 5%. Suddenly that takes you to a new level.
Plus compliance. You don't have a fear that
you're
Medicare will
secure.
come after you and do something crazy. But I tell you, in a normal routine revenue cycle management, what we do,
Right.
normal routine, just by improving the processes and making sure all the charges gets paid, we were able to increase 20% or more revenue.
Yeah.
Across the board, we have found.
Yeah.
Any new practice comes on board with our platform and with these people who are right now listening to you, they all know those that
Yeah.
they have, like, when they touch any practice, it becomes gold.
Yeah.
We call it, in India, we have that thing, haath lagate hi sona ho jaye.
Yeah.
It's the same thing. We touch it and it becomes gold because, there are so much deficiencies in those processes, which used to be very cumbersome, but with the help of technology and other things, now it's just getting them. So what do you want to say to them? How should they look at it? Where should they invest their personal energy right now? I mean, getting the certification, taking all of these good advice we have given them, but they work 8, 9 hours, 10 hours a day. They have some of them have their families, some of them are young, they have their time going somewhere else. When we were young, we used to do those things. So how would they manage or organize themselves that they can attain, or they can go at that level, they can push themselves so hard that they can really be a part of what we are trying to do, and they can also redefine their careers?
So the only thing I can tell you what I did for myself was constantly improve, constantly learn, become a domain expert. Whatever you know, you should be the best in the world. Research everything is available now. Everything, you can research anything and everything. You have resources, you want to find out, you'll find a subject matter expert somewhere online who'll be happy to help you. You have LinkedIn, anything you ask, you can find out.
Well, they are learning right now. If you are training them, I mean, they are
absolutely. I'm online, I'm teaching these
yes.
people, and now they're teaching me after 3 months, because we have that hunger. So hunger is the most important thing.
Hunger is the most important thing. That's good.
If you have the appetite, you can accomplish anything.
So hunger is the most important thing.
Absolutely. And then you have to be creative with your knowledge. How can you contribute? I mean, I'm telling you, the work that in revenue cycle management that is being done, we haven't scratched the surface. Once you do that, you will realize that 20% will become 35, 30%.
Right.
You will be so valuable to your clients and your patients and your doctors. You'll do an amazing job.
No, absolutely. That's the whole purpose, that how we can upscale ourselves, how we can, love our clients, and then do the things to, as you said, add value in their business. Because if we are able to add value in our clients' businesses, they are going to be clients for us forever.
Absolutely.
So fantastic.
Upscale and upskill.
Upscale and upskill. That's good. That's very good. Well, let's see if anybody else has any question for Dr. Singh. We would love to. Yeah, please write it. Somebody says Deepak Madhwani, he wants to ask a question. Go ahead and write your questions. We both are ready to take your questions. I mean, this can go up to. So first thing Dr. Singh has said about upgrading yourself, take some kind of certification, whether it's AAPC or anything. In our organization, we have said that we would pay 50% of anything what they want to.
50%?
They want to.
That's very good.
50% for AAPC. If they want to take a certification, go ahead and do it. We are hiring. How do you see now the buildings are fallen? We don't need buildings anymore. So I was seeing now, people are sitting at their home and now doing all of this thing, how do you see all of this thing happening around us? Because that gives what do you think about it?
Yeah, so it will change. The question is, how good is your connectivity from homes? If it's good,
Right.
you can reduce the pressure. The cost of the brick and mortar will go
Uh-huh.
down,
Mm-hmm.
and then you can have people work from their homes. If that, which is what we had to do, we had no
Right.
choice. We almost had almost 95% people working from home, unless people had gone to their villages where there was no connectivity. But people worked, and people staying at home, actually, they became more productive. It's
Mm-hmm.
very interesting.
Right.
So,
I become more productive. I started working from home last 10 days,
yeah,
and I will be working for next 10 days. I love it. It's independent, free, and I can do whatever I want. I can take care of myself. So somebody from Hyderabad, he's asking, how many people would you be hiring by 2021 in India? So you said, well, you have a requirement of 200 people. And I said, I would be probably at least hiring 100 people the way we are growing in just a normal business processes. But how do you see hiring going on? I mean, would people be, so let me put it this question this way. I think what he wants to know, is there any hesitation of accepting remote workforce as a global workforce in the minds of physicians and doctors and we call them like corporates here? Is there any kind of resistance,
two
or they are
questions,
pretty open? Yeah.
two concerns. One is security.
Okay.
So, as you know, we're getting slammed by these ransomware. We just got hit a month ago, 30 healthcare companies, and they came and encrypted them. Address was in India. So, I don't know if it was truly India or someone, using an Indian address. So, security, if we
So they
have
have
to.
to be very careful when they manage and organize their own PCs, computers,
Yeah,
of the
yeah.
companies who are listening. Okay, how they do it, they have to be very, very. They have to basically provide a safety net too. But problem is when they do this, even before that, so it has to come from some kind of third party audit. Like we have a HIPAA security assessment, which we
Your
do every
DMZ,
year.
you'll have to do your DMZ and all. But also, people have to get laptops that are cleaned by us, we have clear requirements set up for vendors. People were streaming movies, people were opening Gmail accounts. All that has to be cleaned out. So, security is one. Second is talent. So, do you have something to offer? What do you bring to the table? We have hired people in Australia, people who are doing AI for us in Australia. In Malaysia, our security guy came from Malaysia. Our app for web and the app development was done in England. Our leaders, project managers are in Canada, and so I mean in US, of course, Bangalore, Noida, Jaipur, Hyderabad, and you know that we have worked with different people. So there is no limit now on the global. It's truly become a global
Village.
talent. Yeah, talent is available but connectivity, do you have the ability to connect, and do you have something to
Correct.
offer? If you
Correct.
have it, well, I'll take it in 5 seconds.
That's exactly. So when we were ramping up our volume 2 months ago, and we said, well, if you have computer at home, you have internet at home, stable connection.
Yeah.
That's the first requirement to be on the job, no matter whether you are working from our office or you're working from your home office. So we started a team in Philippines. And first there were 10 people. Now we have 50 people in 2 months'
Wow.
time. We trained them from the scratch on our process. Some of them are not even billers. They picked up so well because their infrastructure was at place. So I think the government or whoever is giving them infrastructure, their internet infrastructure was very solid. And then the second thing, the communication in English. These are two became like powerful strengths they had. And I think that gave us a confidence that we can we love working with our Indian team. We have been, that team is there for last 10 years, and they have really added tremendous amount of value in our business. But I think it is more like a state level, or I'd call infrastructure is more country levels. Their hands are like limited, and I think internet is a challenge in India at this moment, the way it is growing.
How's your connectivity in Mahindra City?
Mahindra City is good. It's a corporate, so we are able to get some Reliance. We are able to get some 2-3 vendors. So there it is good. At our office it is good, but when it comes to their home office, it's
Right.
challenging. So like today I was hoping to see about 200 people, but since our office is off, 100 people are completely because they have no internet at home. And I told them you can log in from a smartphone. See, you are talking to us from smartphone,
Yeah.
but see, they are not able to do it. So
5G is not there yet.
right. 5G is not there. And even if it is 5G, it's just for the name because they don't have the signals, enough signals. Anybody else has any questions? So Durga Prasad was there from India, from Hyderabad. Deepak Madhwani, go ahead and ask a question. Well, write a question, Deepak. We can't allow you to speak because we have only 2 people. Just write down your question. अच्छा, कोई हिंदी में भी पूछना चाहे तो बोल सकते हैं, हम हिंदी में भी बात कर सकते हैं. डॉक्टर सिंह की हिंदी बहुत बढ़िया है. डॉक्टर सिंह जो है पोएम्स भी लिखते हैं हिंदी में, तो इट्स वेरी गुड दैट his Hindi is good. Well, so I think we had a great session, Dr. Singh. What else
Great.
do you see? How do you see anything else other than healthcare? What else is going to India? What other opportunities you see? Do you see it any other field?
Yeah, I mean IT. I think we're going to take a leadership in app
App
IT
development, right?
infrastructure. Already is happening. Infrastructure management. People are from actually
Wow.
our data centers being managed from Bangalore. IT guys are managing from there. Software is being developed in India. I think hardware also we're going to start seeing some movement in the next few years. They're talking about developing the chips and all in India. So I think it's a good push. I think pharma is going to have suddenly improve, although you'll have to find some new opportunities there. Pharmaceutical industry is going to grow big. As you're seeing, the vaccine industry is going to India has a contribution. Manufacturing will go up. So all these things will go up. Your
Good
supply
signals,
chains.
very good signals coming. Very good signals, yeah. Let me tell you, we have one unique problem, and it's like very common when you have a lot of people in the organization. Some of the people, so as I said, infrastructure is limited in India. We have some other like issues which are caused by different reasons. People leave your organization and they want to come back. They want to perform. Here, I know in United States, we give people second chance. But in India, sometimes the mindset from some of the organization or people, leaders, I call them, they are very reluctant to give people a second chance. How do you function when it comes to the corporate how do you break this kind of mindset? How do you what advice do you have for? We have a lot of people, and those who are managers for a long time. They are managers for the sake because they have been managing people from the day one, or somebody made them managers. But they are very reluctant to the idea once they become judgmental about something and they say, hey, this guy is like that. ये तो सुधरने वाला नहीं है सर. सर इसको आप कितना ही दे दो, इसको पैसा भी दे दो, ये सुधरने वाला नहीं है. How do you see? What advice do you have for move away from? I have been trying very hard with them that they should move away from this mindset, and people should be able to welcome everybody in the organization. Even if they leave, they can come back. So what do you think? Just give them some like advice, wisdom. That's a very common issue we have in our like a corporate structure of our company.
So it depends on why the person left. If the person went for better opportunities and has talent, then it's our failure.
Correct.
That's how I see it, because we could not give them the leg up within the organization. I'm not pointing fingers, but then I have failed, that I have not given them the opportunity to grow, or
Correct.
somewhere the engagement was not intense enough that they didn't give me a chance. So if such a person realizes, because our goal is to treat everyone with respect, treat everyone with utmost, without any bias or discrimination, people often will want to come back, because then they realize the grass on the other side is not greener.
Correct.
So if they went for in a nice way, if they didn't break any relationships, if they were honorable, then I will always bring people back. My goal is always to give people a second chance. We've always done that. Unless they've burnt their bridges or done something wrong or nasty,
right.
harmful, then of course, it's out of question.
Right.
So if it's a learning organization, if it's the goal should be to find what is good in each other
Right.
and to enhance that and to cover each other's weakness. If we can do that, and it's a very tall order, but it's like playing cricket. Everybody cannot be the wicket keeper, everybody cannot be the bowler, everybody cannot be the batsman, but together helping each other, you
It's
can
like a
create a great
teamwork.
team. So each person has talents, aptitudes, skills, thought processes. If you can start working like that as one team, then you allow each other another chance, then you help each other grow. That should be the goal of the organization, but that's a culture that takes a lot, and it has to be, each individual has to start looking at himself first and start kind of as if in a mirror and start improving himself or herself. If that is the approach, then you will have good things happen within the organization. Takes time, takes a lot of time to build that culture.
No,
But
absolutely. You're right
yeah,
about that. You're
yes.
absolutely right about that. So you said it's okay to give them second chances as long as they understand the rules.
Set
They haven't burned the bridges in a bad way.
set expectations, clear goalposts, timelines. If you cannot measure it, you cannot assess someone.
And that is the problem of the, yeah, I think that's where the data, that's the problem, is how to measure somebody's kind of intentions, or somebody's private, sometimes people have their private politics going on, or they have private favors to ask from somebody, and then that because of that they make wrong decisions. So, well, we understand. Somebody asked a question that how do you, what kind of artificial intelligence you were talking about, and if you can guide us a little bit about them in healthcare, that would be great. I mean, if you have time,
Yeah.
please. Yeah.
So artificial intelligence is not that artificial.
Mm-hmm.
We say artificial intelligence. There's a lot of stuff in artificial intelligence, starting from very basic automation of repetitive processes, which is what we call robotic process automation, or what you call bots. Things that you're, say, as someone has to scan some files every day and it has to go in certain areas. That can be trained. The machines can be trained. So that is simple automation where repetitive work can be passed on. That's called RPA, robotic process automation, and it's already being used, and you will hear a lot about it. If you can learn about it and know how to do it, it will be very good for you and the organization. Waste of time is reduced and efficiency goes up.
Mm-hmm.
Second kind is natural language processing, natural language generation, which is helpful in our industry because we write notes. All that natural language processing can pull the codes and automatically send it. Then the third level then it becomes more complex. Analytics starts analyzing gaps, starts looking at possibilities, starts giving ideas, and then you have to train the machine. Machine is not going to know by itself. You have to train it, and until a process where it starts what is called auto-trainable approaches. They call them neural networks. That is where the intelligence bit comes in. But that intelligence is just that the processes are able to refine themselves. Then, of course, you're reaching into a different level of what is called quantum computing, where you can handle a lot of data, or data that is not organized, what is called plastic data. And then you have to be able to derive conclusions from it. And then, of course, as you might have heard of the chess player, what was that, Blue? I forget the name. It used to be IBM used to own it, or owns it, and
Right.
it could beat the greatest people at the chess master. I don't know if it was Vishwanathan.
Dr. Watson.
Watson, yes. So it beat the world number one chess, Karpov or Kasparov, or someone was beaten by it. So it's just analyzing all kinds of possibilities and then picking up the best possibility. How does it know that? It's been trained. And so more and more you
train. They are asking that, is that going to artificial intelligence take over some of the coding skill set?
Yes, so that's why you have to upskill yourself so that you can take over that. See, it's like riding
a tiger. What can they do to upskill? So they can apply artificial intelligence, but at least we would need people who would use artificial intelligence.
Right. We have not reached the point where artificial intelligence runs our lives or runs our intelligence. We still need to be more intelligent than the artificial intelligence. That's the only way out, right? We have to become more intelligent. We have to become smarter, sharper, more aware. That's something that the machines don't have. And if we do that, then we are always in demand. If you're only at a repetitive level, you're at a spinal level, you just keep doing the same thing, well, someone is going to replace you. Either someone will replace you or something will replace you.
So I think जो वो पूछना ये चाह रहे हैं, मैं आपको उन लोगों को हिंदी में भी समझा देता हूँ, ये लोग क्या पूछना चाह रहे हैं कि जो आर्टिफिशियल इंटेलिजेंस है वो कौन सा ऐसा काम है जो वो रिप्लेस कर लेगी. तो मेरा कहना यह है कि जो काम अभी ये लोग कर रहे हैं ना, जो स्टैंडर्ड काम कर रहे हैं, वो तो बहुत इजी है रिप्लेस करना. तो जो डेटा एंट्री का काम है, क्लेम सबमिशन का काम है, चार्ज एंट्री, एआर कलेक्शन, वो सारा काम आर्टिफिशियल इंटेलिजेंस कर लेगी. लेकिन अगर इन लोगों ने अपनी माइंड, उसको जो स्किल सेट है, ये जो आप क्लिनिकल आप बता रहे थे कि डॉक्टर ने कंप्लायंस की कि नहीं की, उसने लैब टेस्टिंग के लिए भेजा कि नहीं भेजा, और रिजल्ट को कोड किया कि नहीं किया, हीडस किया कि नहीं किया, सीडीआई किया कि नहीं किया, वो सारा काम अभी आर्टिफिशियल इंटेलिजेंस नहीं कर पाएगी. मे बी डाउन द लाइन मेनी इयर्स इट कैन डू इट, but we have to be competitive in both the scenario.
Absolutely. Also, remember, in CAPS and HOS, that's the 50% of your quality is CAPS and HOS, which is totally dependent on your engagement with the person. Right. So if you develop the engagement, then you have to improve your English and improve your communication skills.
Correct.
So you can call from there, talk to the patient here, make friends with him or her, so that you get the best CAPS score and HOS score. So machine cannot replace that unless you reach a very high level of communication. That is not there, no? The human touch.
Yes.
That will be always, that's what makes you unique. So whether you are face to face, whether you're on the phone, you can develop that touch, build relationships, and almost like a CRM, customer relationship management kind of an approach. Right. And that will improve your quality scores. You always have to stay more intelligent than the machine. There's no excuse for becoming, from dumbing yourself down.
Right. Abhi, I was actually looking into yesterday, MGMA ka latest wo aaya hai. They have put 9 telemedicine code permanently. Those 9 type of codes you can see permanently through telemedicine.
Yeah.
So somebody is actually asking question ki telemedicine ke kaun se codes hain which provides an opportunity for us. So telemedicine में कोई ऐसी opportunities आपको लगता है कि जो कि good for these offshore people, what they can do?
Yeah, telemedicine is amazing. You can do so much in telemedicine. Again, the same analytics. You will have remote monitoring, so much data coming. We are creating what we call centers where we can watch all this data coming in, take immediate care of patients. Why can it not be in India? You can have these centers. If you can have remote monitoring for my servers.
Remote patient monitoring, yes.
Why can't we have remote patient monitoring from India? Why can't we have immediate response? Learn the system, then you can help the patients here.
Mm-hmm.
So that is, there is so much to do.
Right.
You just have to be creative and you have to constantly challenge yourself.
Correct.
If you stop challenging yourself, you're finished. It's all over.
That is true. So challenge yourself, learn new things, keep yourself busy with always beating the technology. That's what you said. You beat what's coming. So what you're doing, if you stay status quo, technology will take over. So their enemy is not somebody human. Their enemy is actually technology. They are going.
Your only enemy is you yourself.
Yes, yourself. So you upgrade yourself and beat the technology and
you have to.
That's good. That's very good.
You have to know what is happening, and then you have to adapt to it. Humans can adapt very fast.
Correct.
What did we do during COVID?
Mm-hmm.
All the migrants coming, all the mess up. What did we do? We adapted very quickly.
That's
Indians
true.
are very good at adapting. So we can do a lot of things. We just have to have the confidence.
Another question they have asked about, I think they ask, that's a transportation. How do you see the transportation issue going on now? So as you answered already, like people should not be just worried about transportation anymore. They can work from home, find good infrastructure, or find a home where they can find a good infrastructure.
Yeah, so you have to create small places, Kunalji, across the country, like what is that, OYO or something like
Oh
Starbucks?
yes, the incubation centers even. The incubation centers where they are providing in internet infrastructure and office. Like we have it here, small offices where people can go and work from there. Yes, I mean in India they should look for those kind of incubation places where they have internet. And if they don't have internet at there, so this person who is talking about that he takes 3 hours to come to the transport, but why can't he work from those incubation centers? That's right, Dr. says that answers his questions. So I think they have a lot of questions around coding because you have sparked the light in their mind. So
What you can do is we can again get together.
Yes.
Because otherwise my
Let's do
children will
another
start
session. We
beating
had a
me up.
great session so far, and then we can always do. We need to meet every week, actually. We need to do that.
Yeah, they can put questions. You can put questions together,
Correct.
and then next time we can again talk
Do
about
a
these things and have a.
And we'll include our international team. We'll do
That's
one big session for everybody.
That's
Well, thank you very much, Dr. Singh, and
Thank
thank
you.
everybody. That was fantastic. We'll connect again. It was a very, very enlightening session with you, Dr. Singh.
All right. Have a good one, everyone. Thank you.
Thank you. And it's being recorded, so it will go on YouTube if you want to. Anybody wants to see it on Practice channel. So, thank you.
All right. Thank you.